Hi, everyone, and welcome to today's What's New in Addiction Social Work lecture. Thank you so much for joining us. I'm Zan Rothenberg, one of the program co-directors, and our other co-director is Jessica Mensinger, and she's on as well here. She'll be facilitating the questions at the end of the lecture, and we would ask that if you're able to put questions in the chat box, that would be wonderful. The sooner the better, because there's sometimes a little technical glitches that happen at the end when we're trying to facilitate questions. So that would be wonderful if you can put them in a little earlier on. And with that, I'm pleased to introduce Andrew Kerr, who will be presenting on self-care and social work practice. Just a little about Andrew. He's one of our current addiction social work fellows. He's a registered social worker who currently works with Interior Health. He's a practice lead on the substance use team of the Mental Health and Substance Use Network. This role was created in response to the toxic drug public health emergency. Andrew's worked in 2 health authorities in a number of roles, including inpatient, community, and leadership roles. And when Andrew is not at work, he can be found with his kids fishing on Okanagan lakes or hitting the slopes at Big White. And with that, I'll pass it over to you, Andrew, to start your presentation. Thank you.
Thank you very much. And while I'm from Lake Country, I'm living the hashtag fellowship life right now, and I'm in Abbotsford. All right, so I want to start off by acknowledging the homelands of the First Nations whose territories we gather on. I want to thank them for the stewardship of the land and recognize the historical and ongoing racism and impacts of colonialism that we witness and learn about in our professional and private lives. I invite you to take a moment to consider your own relationship with the lands and the Indigenous territories that you are connecting in today from. And today I want to acknowledge that I'm on the shared territory of the Sumas First Nation and Matsqui First Nations. These 2 First Nations are part of the Stalo Nation, and the Stalo people have lived in the Fraser Valley for over 10,000 years. As was mentioned, I work for Interior Health, and I have no other conflicts or disclosures. And so today, happy to come to talk to you about self-care and social work practice. And so what the plan is for today is to talk about self-care within clinical practice, explore some ethical issues in talking about self-care, and then think about the implications for our own practice. And also threw up a nice little visual from Brene Brown. You know, this great, you know, when I saw it, it resonated with me, this nice little thing about how, you know, in our current culture where there's so much pressure to perform and to just do everything, you know, me as a father and a social worker and, you know, a busy person, you know, it takes courage to say yes to rest and play where exhaustion is seen as a status symbol. So I want to start off by talking about some definitions. And it's really interesting because there's lots of definitions in the literature about self-care. And so I wanted to share a couple with you today. So the one you see on the screen here, you know, one that talks about your general attitude and value about using a wide range of tools that are going to prevent burnout and problems with your professional competence. Right? This probably resonates with lots of people. An alternate description from another article talks about self-care typically refers to activities or processes that are initiated and managed by the professional for the purpose of providing stress relief and supporting one's health and well-being. And so what's really clear is that there isn't a well-established definition for self-care for professionals, and assessing for self-care isn't clear because there's multiple measures in use. Some will look at, you know, specific health activities like how much do you sleep, do you eat healthy, and other use more subjective measurement tools. Self-care, you know, as a social worker, you know, a critique of definitions of self-care is that potentially it positions people as damaged and that self-care is needed. So potentially like blaming to a person, right? Self-care Someone needs to practice self-care when they're damaged, when their functioning is impaired. And values and attitudes and doing activities that keep us well and prevent burnout. Lots of these definitions don't consider social determinants of health. So people who experience poverty, people who experience racism, these kinds of things. And so what I stumbled upon in a wonderful article is that self-care is best described by the person engaging in it. Also like to talk about some definitions of compassion fatigue. Compassion fatigue is, something that we've all heard of. Maybe people, have different thoughts about it based on what you've seen, based on what you've read, based on what's in the media right now with, the various health crises that we're experiencing or being reported on. Compassion fatigue was first described in 1995, and it's been widely investigated in the literature. But concerns have been raised about the ability to actually measure compassion fatigue. And so interesting, the Hoffmeyer article that's referenced there, it brought this interesting thing about compassion being a finite resource with somebody. So potentially it can imply that you have reserves of compassion, that when you go to work and you're working with people and you're tapping into these reserves of compassion, that it can be depleted, that leads to a cause and effect. It leads to harm, leads to some sort of burnout. So then, why would somebody want to be more compassionate if it can lead to the harm? Their research has shown that compassion can be taught, and you can practice it, and it increases resilience. And then neuroplasticity studies show that compassion training, it doesn't take away negative emotions that people experience, but it increases activation in our brain areas that are associated with love, positive emotions, hope, and reward. And then there's overlapping terms with compassion fatigue. So people might have heard the terms vicarious trauma, secondary traumatic stress. There's lots of overlap between those. And the article on screen here, they suggest an alternate description of the phenomenon of compassion fatigue as empathic distress. So when we open up our hearts to other people's pain, that we can experience that pain there. And what I found reading through the literature is that some researchers use these terms interchangeably, and some identify them as unique constructs. And so the boundaries between them, depending on what you're reading or what lens you're reading from, could be ambiguous. And what is interesting too is that in the DSM-5, the diagnosis for post-traumatic stress disorder includes provision for people who've experienced secondary trauma in their professional role. So that would be kind of at the extreme end. And so burnout, again, some ambiguity perhaps with these terms, but what we're looking at on the screen here is from the International Classification for Disease. So this is a syndrome that's described by the ICD, World Health Organization, that results from the chronic workplace stress and where you see the energy depletion. So again, thinking of that concept of that the compassion can be depleted, the energy depleted, and then the distance from your job, and then your job performance is impacted. And so this is like it's a chronic thing. So it's not going to happen overnight. It's something that is likely going to progress over time. And it's burnout specifically talks about the occupational context, and should not be applied to describe experiences in other parts of your life. And burnout, of course, is linked to client outcomes. So clinicians who experience exhaustion or burnout, they derive less joy from doing their work, from doing their jobs. And so as a result of having less joy at work, it potentially means that you're putting less into the work that you're doing with your clients, which potentially has impacts on the outcomes that you have with clients, that then can become like a perpetuating downward spiral for people. So what's important is, self-care is, staying within this healthy range of this mental health continuum model. This was created by the Mental Health Commission of Canada to show a spectrum of responses to stress. And so all the healthy responses, the positive, the strengths-based things when we are healthy, and our mood and our thinking and our emotional health and our spiritual health is all good. We're functioning well, we're sleeping okay, we have our sense of humor, we're doing a good job. And then depending on what's happening in our day, depending on what's happening in our lives, and then maybe, depending on how often it's happening, how much support or resilience that we might have, we might move towards the injured or the ill side of the spectrum here. And of course, many people will know some of the effects of stress on people. But when stress happens, it can impact your physical body. You can experience headaches, muscle aches, gut problems, sleeping problems, weight gain, weight loss. On the emotional side, we can become frustrated, irritable, sad, hopeless, and feeling overwhelmed. Our psychological health, where we lose our ability to concentrate. We have confusion, we're not able to make decisions, and we lose our sense of humor. And then on the spiritual side too, things can feel meaningless. We can feel disconnected from the work. It can result in interpersonal problems and worry about the future. So Simeonato here suggests a communitarian model. So a communitarian model meaning that more than just you is going to be responsible for your own self-care and your health and your wellness. And so starting at the outer ring here, in this communitarian model, we think about a person-centered workplace that puts people at the middle of a productive workplace. Of course, our work with our clients and our patients is really important, but some of the economic drivers that infiltrate our work, whether that's inclusion, exclusion criteria for programs, whether that's stats and stuff that we have to connect with, whether that's hierarchical relationships that happen in our workplace. It puts workers at the middle of everything. And so if workers are in the middle, then the workers are going to be supported by leadership, by policies, and then that's going to empower people to do better work with clients. And then moving in, our peer and collegial community, again, it takes away the focus from the self-monitoring of self-care, and it creates a supportive community. And so this community doesn't necessarily have to be your immediate coworkers, but it could be communities of practice that you participate with, workshops that you participate in, conferences you go to, that kind of stuff. This can also include supervision models that are not hierarchical or rely on only you to monitor. Professional advocacy, is thinking about the professional regulatory agencies and associations that we're involved with. They set practice standards that guide our practice and ultimately protect the public. And they should be helping to design more supportive workplaces and really setting the tone for productive work to happen, and moving away from punitive ways to dealing with people who experience workout. In social work, it's like it's in our code of ethics that we have to maintain our self-care, because if it goes unchecked, we potentially can do harm to clients. And so if that happens, then there's like the self-responsibility to stop doing the work if you're doing harm. And then if others witness the work, then it brings into other things like duty to report, whether that's to an employer or to a regulatory agency, so that no harm has happened. So moving away from a punitive model to a more supportive model of being able to recognize signs of burnout. And then, of course, in the middle of it, there's the individual self-care, the person who thinks about, balance in their life, balance in their day, self-awareness about what's happening in their minds, in their hearts, in their guts, and then also looking at their own professional development, making themselves a stronger clinician, learning more, gaining comfort in areas that are uncomfortable. Want to move on now to talk about some ethical issues in self-care. And so the first talks about the role of training programs. So thinking about social work schools, and of course there's other professions represented in the fellowship here, and thinking about how self-care is developed as a clinical skill for new social workers and new professionals. And so what this study here talks about is that it basically creates, it says that professionals who are younger, less experienced, experience role ambiguity and become like overly involved in their clients' lives, they're at greater risk for burnout. And another systematic review found that about half of psychotherapists at some point in their career have experienced moderate to high levels of burnout. So we see kind of this, the new to the profession risk for burnout, seeing that there's, experience of burnout for people with more experience. So then there should be an ethical responsibility for training programs to develop those self-care skills while they're in school. Because as people go through, I'm a social worker, so I went through social work school. So lots of the coursework that we do, talks about power and privilege, oppression, trauma, colonization, all these really, really heavy things. And then of course in our practicum experiences and field education experiences, we of course see and hear things that can have an impact. So at the very early stage, we should be supporting students to learn to be able to recognize and then practice those self-care skills. So another interesting thing too is being the social worker, thinking about kind of like the larger social discourse in our society and the neoliberal system that we are essentially operating in now. And if you're not familiar with the term neoliberalism, it basically refers to the market drives everything as opposed to the government, right? So things are left, things like healthcare and education and social welfare, they're decided by the market and capitalism as opposed to being controlled and regulated by the government. So neoliberalism also favors privatization, deregulation, and defunding of spending in things like health and education and welfare. And then what's interesting is this is in contrast to social work education, where one of our core values of social work is the pursuit of social justice. So in recognizing in recognizing power and privilege and oppression, historically social workers have really advocated and fought hard to get people basic human rights and to help create structures that give people help them meet their very basic needs. And then especially in the United States, where healthcare is largely privatized, there's like money and capitalism and transactions at the heart of every healthcare interaction. That kind of goes against these traditional social work, social justice values, where in many ways social workers who work in these large bureaucratic or managed care systems, we're not able to advocate or fight for social change. Instead, we're often becoming in some ways authoritarian and maintaining the status quo and thinking about things like bureaucracy and excluding people from programs that kind of is in conflict with those social work values. A beautiful little meme about neoliberalism here, and so the neoliberal care systems, you know, these have shown to increase burnout, and the things that contribute to the burnout are, complex hierarchies, complex bureaucracies, decreased worker autonomy, inadequate staffing, excessive workloads, poor leadership or poor support from leadership, and lack of opportunities for skill developments, and then potentially negative public images, about your roles or about the systems that you're part of. So here's me. I've put my face at the middle of this system. And so what this neoliberalism critique of self-care means is that I am responsible for my own self-care. If I'm hurting, if I'm starting to experience or exhibit signs of burnout or stress or something like that, then this neoliberal discourse says that it's up to me to fix it, right? It's not up to society to fix it. It's not up to anyone else to fix it. And there's a wonderful quote in this article. It says, the model neoliberal citizen is one who strategizes for her or himself among various social, political, and economic options, not one who strives with others to alter or organize these options. And so the success of the systems that I'm a part of here, personal, professional, my job, my clients, my effectiveness, my ability to practice self-care, is contingent on the success of many of these things, or the success of clients or employers or whatever is contingent on my own self-care. And in this, the critique of this system is that, it's up to me to self-assess for my own self-care, which is inherently biased or flawed, because even if I don't see the signs, other people may see the signs. And so, this article talks about, being passionate and effective. So, there's all these structural issues that we have about poverty and inadequate healthcare, access to healthcare, and stigma against people that use substances and everything like that. Me being super passionate about working with people doesn't mean that I'm going to be able to change the systems for people, and I'm going to experience distress if I'm working in a hospital and a person gets discharged from the hospital to the street when it's 15 below. It doesn't mean that I'm ineffective at my job. And another interesting, swinging it back around to a more strengths-based approach is a model proposed by Vicki Reynolds. Many of you might have heard of Vicki Reynolds. She's a social worker and social activist from Vancouver, who's developed this model called the zone of fabulousness. And the zone of fabulousness is self-care. So it's a person who's within a team, that is person-centered, where there's hope, where it's a collective care. It's not about me ensuring my own safety, my own self-care. It's about me working with my team, shouldering up, as she talks about, shouldering up with my team. And then if we move out of this zone of connection, we can move towards enmeshment. And enmeshment means we're getting too close to clients. We become the hero, we become the martyr, and we go all in, and we work extra hours on a special case. We become a hero, and we start to work in isolation, maybe, and potentially in having a special relationship with people. As we move too close to them, we're potentially replicating conditions of relationships that have led to harm in that person's life in the past. So getting out of the zone of connection, moving too close to people, boundary violations, all that kind of stuff. And then on the other side is disconnecting from the work altogether, where negativity comes into the space, avoidance, numbing. It becomes about me, the staff person. I'm the victim of this system. I'm the victim of what's gone on, not the client who's experienced the trauma or the poverty or homelessness. And she has a great quote that talks about disconnection. So people who don't have broken hearts because they didn't bring their hearts to the work. So in the collective ethics that she talks about is about, being with people who potentially see you or see each other slipping out of this zone of connection, but kind of having the courage to say something, to offer critique, to receive critique, which is often hard, if we're responsible for our own self-care, or we're too polite to say something if we notice someone's having a bad day. So then, as we move out of some of these ethical considerations, want to consider some of the implications for practice. And so the article that I've referenced here, they've talked about some fundamentals that maybe resonate with lots of people, that talk about some of these big domains of self-care: getting enough sleep, eating healthy, getting some activity, having interactions that are enjoyable, and attending to things in our personal and professional lives, and making it part of a routine. So not one-off kind of things, not saving up for that fancy expensive vacation to Mexico or something like that, where you go and spend a ton of resources for a week, but then don't have a regular practice throughout the days or the weeks or months. And then this article also suggests the development of a self-care plan. And so in thinking about a self-care plan for yourself, it's kind of taking an inventory about what's happening in your personal, professional life, looking at what is currently working for you, what strategies do you have in place that helps to manage the stress, and then also acknowledging any ways, the maladaptive ways or potentially unhealthy ways to cope with stress. It also suggests having some diversity in your workload. So if you only work with one type of client or one type of clinic, that potentially could lead to boredom or something like that. So it suggests looking for opportunities to work in different settings, or if you're working with only groups, doing some individual work or doing some of the intake or something like that. This article also suggests, and I think my boss is probably on the call here, suggesting that we work at under capacity, so we don't work at 100%, so that we have a little bit of time in our days and our lives to accommodate for emergencies or urgent things that come up from our family, or to attend to self-care if we're having a crappy day or something's gone on for us. Thinking about the opportunities for students in social work programs or other educational programs is teaching about reflective practice. And so this reflective practice, it helps to bring all the concepts and the theories and the experiences that a clinician has, and helps them to manage the complexity and the uncertainty that comes in our day-to-day practice. And it can include individual supervision, whether that's with some sort of like a hierarchical supervisor or peer supervisor. It can include seminars, trainings about being able to, increase awareness of yourself, in relation to your clients, into your systems, into your race, into your gender, these kind of things, and then being able to critically analyze what's happening with you, and then, really opening up to and trusting in those relationships, recognizing that reflective practice is very relational and very emotional. And then doing this in education programs, this study here, the participants, they after doing this, they report being able to care for themselves personally, professionally, having improved emotional health, higher satisfaction in their jobs, having more longevity on the job as well, and then having a new standard or a model for their future clinical practice. Another article here talks about communities of colleagues as an opportunity, an opportunity for self-care, which is kind of similar back at the beginning there with the 5 Ps of self-care. So kind of putting ourselves in the middle there, and then having those that are closest to us, the inner core of people, that if we have a sticky interaction with a client, or an interaction with a client that made us feel some way or made us question something, that's that first person that we're going to reach out to. and then moving out from there all the way up to the professional cultures of, our legal requirements and ethical standards, and the communities of practices, and all the opportunities that we have. And there's different levels of comfort and intimacy with all of the people at these different levels. And then I really love Vicki Reynolds' model, because she talks about the solidarity teams. And so the solidarity teams, this is from a workshop which is based on the article that she wrote about the zone of fabulousness. So in creating these solidarity teams is considering, what her terms shoulders you up in the work. Is it the people? Is it the places? Is it the experiences, the music, whatever? And really taking a strengths-based approach. So instead of considering self-care and burnout as like a deficit base about what are the negative effects that it's having on you, is what are the strengths of your solidarity team that keep you coming to work and keep you fabulous and keep you accountable to your team and them accountable to you. And then I love that one quote there: who can you howl at the moon with that won't tell you to leave the work? Measuring burnout is another opportunity for people as well. The table that's listed here is from a systematic review of measures about social work and health. And so the tools, they were used across, and they were represented in a number of different studies. And while the tools, are effective in helping people identify things, there's variations, and some of the variations have to do with things like different work settings, the different client groups that people are working with, the different types of work that people are doing. They also, for somebody who is experiencing burnout, participating in some of these studies or doing some of these measures, it highlights. So it kind of creates, that emotional response for somebody. And those who are super interested in system level work, the Institute for Healthcare Improvement has this a framework, a quality improvement framework for improving joy at work. And so if you're interested in this and quality improvement in science, check out this white paper. And there's some wonderful articles and examples from healthcare systems who do this. And really what, where's my slide? There we go. So this IHI framework, it recognizes lots of different domains, such as physical and psychological safety, wellness and resilience, teamwork, measurement of joy, recognition and rewards, choice and autonomy of staff. And when it comes to improvement science, it's not about making sweeping changes in a work culture or in a system that you feel is broken, but it's about what's something that you can try out that's going to make a small improvement by next week, and then you build upon that. So kind of wrapping up the presentation here about self-care is that there are lots of opportunities for more research. The only evidence-based self-care intervention that really stands out in the literature is that of mindfulness, and not much mention of other evidence-based interventions for professionals. The different measures that are used, they get questioned, and rightly so. They get questioned because many of the things can often be very subjective for people in different contexts. Training about self-care and compassion, is referenced in many articles, but it's much more nebulous. It doesn't talk about randomized control trials that improve self-compassion for people or that improve self-care. And really what's interesting too is that self-care, it's evolving. So the concepts change and the definitions change, and the discourse about self-care changes. And we're starting to see, and we'll see more impacts of the COVID pandemic on professions, where where there's much more stress on our systems now than there ever has been. And we're going to learn a lot more about the impacts of burnout in there. And really what I want to encourage you to think about is that, while I've presented some elements of self-care from the literature here, is that self-care is a very personal topic for many people. And really in thinking about what I've presented today and thinking about your own experiences, is that maybe this is some time to just reflect on your own experiences of your work, your own experiences of healthcare, of self-care. And if this wasn't a didactic lecture, then this would be the time where we open up a wonderful conversation about great examples of self-care and how we can support each other in doing this work, and learn more about keeping ourselves healthy to do the work, so that ultimately at the end of the day we bring ourselves for the clients. And I think that brings us to the end.
Thank you, Andrew. That was great. And I can definitely see a future for you maybe in putting on some more interactive workshops on this topic. So really appreciate what you brought today. I do have a couple of questions that have come in. So just referring to the scale of measuring burnout that you referenced, how do you see this being used in the workplace, and what recommendations would you have in actually applying this in work settings?
Yeah, thank you very much. And so one of the scales that I've used with the team before, it was that professional quality of life. And so I think what's really important is kind of introducing what the scale is, what it's going to measure, so that if somebody's answering it, you don't want to inadvertently trigger somebody to to a negative experience or something like that. So when I've done the professional quality of life scale before, it starts off with basically a bit of psychoeducation about introducing concepts of compassion fatigue and compassion satisfaction and burnout. And then we move into the score, you move into the scale, and then that provides some of the context for people to do it. And then after people have done the scale, then doing a bit of a debrief with people, whether that's individually or as a group, or some of them you can actually like collate the scores and present the results back to the team, so that it's not done in a one-off way that potentially causes emotional harm to somebody, just in trying to measure something. So doing the whole thing in a very supportive way.
Yeah, I appreciate that. And I think that the other piece of it is it actually maybe provides a really tangible tool to bring some of these more intangible topics to the workplace. So I appreciate that. The other question that we have is a little bit different. So given the existence of systemic racism in our healthcare system, did you come across any research focused on self-care strategies for Indigenous healthcare staff or Indigenous clinicians? And what can employers do to promote this without pushing the onus back on the individual?
Yeah, thanks. That's such an important question. And excuse me. While I didn't come across anything Indigenous specific, it makes me think about that neoliberal discourse where it puts the person at the center of their own self-care. It makes me think of my own benefits. So I work for Interior Health. If an immediate member of my family dies, I get 3 days off. That's it. And then after that 3 days, I'm expected to be back at work, present for my clients, present for my projects. So it puts the responsibility on me to pull up my bootstraps, so to speak. And so I think this absolutely is an opportunity, and I think this is something that the large organizations are going to need to grapple with, is that our benefits don't define what wellness is for somebody, because these large systems cater to the majority, right? So it doesn't always consider alternative views, and so that's absolutely a huge opportunity to support people. You know, self-care being so individualized, you know, meaningful to the person. People need to be supported in the way that's most helpful to them.
Yes, I appreciate.
How's that for a social work answer?
Yeah, I appreciate that thoughtful answer. Actually, it is an important topic. I'm going to pause for a second just in case any other questions come up from the audience. Please feel free to put them in the chat, and we'll make sure to ask Andrew. So we did have another question come in. In spaces such as healthcare, where we work alongside other professions where overwork is valorized, what are the risks for those who are trying to implement a culture of strengths-based self-care?
Can you read that one more time, please?
For sure. Move it over so I'm looking in front of me. So the question is in spaces such as in healthcare, where we work alongside other professions where overwork is valorized, what are the risks of those who are trying to implement a different culture, so a culture of strengths-based self-care?
Yeah, I think that's a really good question, and I think, you know, it's, you know, it comes down to like the relational experiences, really, right? So the risks, the risks of, you know, the risks, I think, are recognizing the roles of things like power and privilege and position in there, you know, people as experts, people as, you know, directors of care, of supervisors of work, assigners of tasks, all that kind of stuff. So the risks are burnout and kind of poor health and interpersonal conflict and all of those. And I think, you know, the opportunity, you know, makes me think of the Vicki Reynolds work about, you know, about trying to focus more on the strengths and not focusing on deficits or risks or negative activities. You know, being there for people, showing up, you know, showing up for the work, honoring people's vulnerability, you know, being courageous to offer support if you see somebody is, you know, isn't there.
Yeah, perhaps as well, you know, the risk is going against sort of the norm, right? So when the question is talking about this shift in culture where, you know, overwork is often rewarded, right, with different things. And so maybe redefining what we view as success and a successful person at work. All right, I'll pause one more time just in case any last minute questions come up. Okay, well, with that, I think I will call it and thank everybody for joining us today. I hope that you all found one nugget that you can take back to your work. And Andrew, I really appreciate you spending your time to look at the latest literature and share some new pieces of information around self-care with us. So thank you.
Thanks, everybody.